new season is starting with a warning to expect another summer of record high wait times in hospital emergency rooms and more closures. That's according to a report in the Canadian Medical Association Journal, and it echoes the message from doctors and nurses that Canada's ERs remain in crisis. Let's bring in Linda Silas, president of the Canadian Federation of Nurses Unions. Ms. Silas, thanks for joining me on this.
It's my pleasure.
So the CMA Journal says this summer will be precarious and exhausting for ER staff, that there will be dire outcomes for patients, for providers, and for the system as a whole. So certainly a bleak outlook. What's the current situation for nurses, and what can they expect on the front line over the next few months?
It's the same, Andrew. You know, we have to see our ER system as the front door to our healthcare system. So what's happening in the ER is double, triple the effect on the floors, from med-surg to labor delivery to mental health services. The summer is going to be as bad as last summer. And that's hard on our nurses, our doctors, of course, because they can't provide the care they want to. But it's hard, and really hard, on our communities, thinking, when will this end?
So then what is the upshot for patient care? You talk about the staffing shortages and the domino effect. What are you expecting to see this summer?
Well, longer waits, more people in the ER. You know, you saw the horror visions we saw last summer, and it continued through the years. It's not only a summer event, it's really continuing on, where patients just sit there for hours and hours because there's no doctors, nurse practitioners to see them immediately to do their assessment. And then often they have to wait because there's no beds for them in the hospital itself. We have to revamp our whole healthcare system. We know that. We need more primary health care. We need more long-term care, more mental health. But we have to do that parallel at the same time that we service those communities that need the emergency rooms open, that need hospital beds open, and we need enough staff to do that.
So then what are the short-term measures the governments need to move on? Because you have talked about some of the examples you gave are really multi-year projects, right?
Yeah, exactly. We have to look at a long-term vision of our healthcare system. But immediately what nurses, what doctors, what other healthcare professionals are asking is respect me. Respect me as a healthcare professional. Respect me as a human being, that I have a life outside this facility, and let me do a great job. So what employers are stuck in doing right now is going through agencies. So they're paying $200 an hour for a nurse who will come to fill a hole in a rotation, while her coworker, the permanent, the committed staff, is paid $50 an hour and will be mandated to do overtime. So we really need to look, how do we treat our committed staff, and how do we make their life easier with more support staff, with, of course, better rotation, better staffing measures. And all of that can be done by us all working together with the committed staff we have.
Now, the federal health minister was asked about this yesterday, and says that there is some progress being made on staff retention, on recruitment, and on recognition of credentials. Do you agree with that assessment?
There's a lot of work being done on internationally educated healthcare professionals. The federal government and the province and territories have put a lot of energy there, and it needed. We needed it 10 years ago, so it's being done now. We're seeing a lot of governments giving bonuses here and there, and are they working? We don't know yet. But really, we only have 2 provinces where they're a beacon of light. British Columbia, they've just implemented, or in the process of implementing, mandated nurse-patient ratio. Minister Dick said it's my responsibility to make sure there's enough nursing staff to properly take care of our patients, safely take care of our patients. So they've implemented nurse-patient ratios, and now they have the highest salaries also across the country. And then there's Nova Scotia, where the Premier is really giving a commitment to his nursing staff that we're going to work with your union. We're going to have better wages, better working condition, and fingers crossed they'll be talking about nurse-patient ratios soon there. The rest, it's a real challenge.
And as you say, you give some examples there of provinces taking some action with new measures. We've seen provinces and the federal government promising more money and more measures to ease the pressure, and the situations with staffing and wait times has certainly got a lot of media attention and political attention over the past year. I know you just gave a couple of specific examples, but overall, is there anything that's giving you a sense of optimism about what everyone is calling an ER crisis?
Well, optimism is a big word. Everyone's talking about it, so that means we will see action if we continue on putting the pressure. I see the same situation as I saw last summer, and I'm hoping that by September we will be able to say that the federal government, the province and territories are really continuing to build the recovery, complete the recovery of healthcare. Post-COVID, I know we're still in COVID, but I mean post the 2 year of crisis, we needed to rebuild our healthcare workforce. We need to do it. For CFNU, we'll be meeting with the premiers at the Council of Federation with examples, again, on how we can all work together to retain. That's the number one thing right now, is really to stop the bleed. We cannot let one doctor leave. We cannot let one nurse leave. We cannot let one healthcare professional leave our system. So what will it take to have you stay in our system so we can serve Canadians properly, and we will all work together to reform our healthcare systems for a better system?
Okay, we have to leave it there. Linda Silas, good to get your view on this. Thanks again.
Thank you.